Hello everyone, it's Dr. Joe Dione here, and as February is American Heart Month, I want to take some time this week to talk to you about two conditions that we want to make sure that we can identify if they are occurring in ourselves or in those around us, and that is heart attack and stroke. First, we're going to discuss a heart attack. Many of us have heard this term before, but I want to make sure that we go over a little bit of detail about what is occurring in a heart attack and what the common symptoms might be. The heart is a very strong muscle that functions all day, every day, and as such requires a great deal of oxygen to be supplied from the bloodstream. There are a series of arteries known as the coronary arteries which supply oxygenated blood to the heart. If there's ever a narrowing or blockage due to a buildup of fat, cholesterol, or plaque, then this could lead to damage or death to the heart muscle, and that is known as a heart attack. The warning signs or symptoms of a heart attack can vary from person to person. However, there are some more common ones that we would like to discuss to give us an appreciation for being able to detect this early on. Oftentimes, individuals describe chest discomfort that may come and go or may stay constant and feels uncomfortable pressure, squeezing, a fullness, or pain. There can also be discomfort in other areas of the upper body, including pain or discomfort in one or both arms, the back, neck, jaw, or stomach, and some people have even described it as feeling like a very strong acid reflux or heartburn. Shortness of breath can also occur with or without chest discomfort, and additional signs could include breaking out into a cold sweat, nausea, or lightheadedness. If you or someone you know experiences any of these symptoms and you believe that there's a possibility that a heart attack is happening or could happen, please call 911. Never drive yourself to the emergency department because if the condition increases, you could become a risk on the road and severely injure yourself or other individuals. It is reported that every 40 seconds, someone in the United States suffers from a heart attack. This is very important to understand the signs and symptoms and other information about that. The American Heart Association has an excellent website, and I highly recommend that you check it out. Now that we've discussed the symptoms of a heart attack, let's talk a little bit more about what is occurring during a stroke and those symptoms that might come along with that condition. Stroke is a disease that affects the blood vessels that supply the brain. It is the number 5 leading cause of death and a leading cause of disability in the United States. A stroke occurs when a blood vessel that carries oxygen and nutrients with the blood to the brain is either blocked or bursts. When that happens, the part of the brain can no longer receive the oxygen that it needs, and that region of the brain and its brain cells die. This can lead to long-term deficits for any of the actions that part of the brain was responsible for. The American Stroke Association reports that 80% of strokes are preventable. The American Stroke Association has a very informative website that you will want to check out to learn more about the warning signs and symptoms of a stroke. The FAST, or FAST warning signs, is something that you can do if you believe somebody is potentially suffering from a stroke. The F stands for face drooping. Does one side of the face droop or is it numb? Ask the person to smile. If the person's smile is uneven, then they are positive for face drooping. The A is arm weakness. Is one arm weak or numb? Ask the person to raise both arms at the same time. Does one arm seem to drift downward or not be able to raise as high? Then they have arm weakness. The S stands for speech difficulty. Do they have slurred speech? Just give them a very easy sentence, whichever's on top of your head, and ask them to repeat it back to you. If they are unable to do so, then they are having some speech difficulty. If they have any or all of these symptoms or any combination thereof, then you definitely want to get to T, which is time to call 911 and get them some immediate help. Other symptoms that can occur with stroke are sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination, and a severe headache, especially when there is no known cause. While heart attack and stroke occurs in both males and females of all ages, the risk of these conditions does increase as we get older. Additionally, about half of all Americans have at least one of three key risk factors for heart disease, and these include high blood pressure, high cholesterol, and smoking. It is recommended that you discuss any potential risk factors that you have with your healthcare provider and see if there are any medications or behavioral changes, such as change in diet or exercise regimen, that you can do to try to decrease your potential risk for heart disease. I hope you all found this information helpful and that you take some time to go over those websites discussed to learn even more about heart attack and stroke and the symptoms that come along with each. I want to emphasize that not everyone's going to have the same symptoms for these conditions, but it is helpful to know what the most common ones are so that we can have an idea of when to make sure that someone gets help in a timely manner. Take care and have a wonderful week.